Joining us now, Admiral Brett Giroir, Assistant Secretary of Health at the Department of Health and Human Services, and a member, of course, of the White House Coronavirus Task Force. Admiral, thank you very much for being with us. First, let's talk about the numbers. More than 3,000 people across the country. And
yes,
testing
Andrea.
is still in high demand. I know there's been a lot of massive testing, but even right now in Virginia, unless you're asymptomatic, you can't get a test.
So you're exactly right. We're at this crossroads right now that everyone is incredibly excited because we have a vaccine, probably 2 vaccines and even more that are going to be coming. We will be immunizing 20 million people in December, another 30 million in January, another 50 million in February. But the reality is right now, we've got to do what we've been telling everyone to do, and that is wear a mask, physically distance, avoid crowds, because those numbers are going up, and the vaccine will not provide immediate relief. We'll get it to the elderly and start protecting them, but it's going to be into 2021 before the majority of Americans can be vaccinated. So it's really critically important. The light is at the end of the tunnel. We know how this pandemic is going to end. But until we get that vaccine distributed and into the arms of hundreds of millions of Americans, we're going to have to do the things that Americans know how to do and have done before.
Well, one problem has been that a lot of people are ignoring all the good advice from you and others. These new cases are now being linked to the Thanksgiving holiday, travel, people ignoring the advice to not have large family gatherings, and we're now only 2 weeks from Christmas Eve. These holidays are piling up and exacerbating the problem. What do you want people to do now? We're in the holiday season.
You're exactly right, and I know this has been incredibly difficult on the American people. This has been almost a year of isolation, stress. People have lost their relatives, loved ones, friends. There's been social isolation. You name it. But what I'm imploring the American people to do is understand this is not forever. We're going to have 100 million people vaccinated by the end of February, but we have the ability to save or lose tens of thousands of American lives, depending on what we do. We know that if we do these simple measures, and it's not forever, it's for the next couple of months, we can flatten those curves like we've done in April and we've done in July. And European countries have done just recently with their outbreaks. We don't need to close schools. We don't need to close universities. We don't have to end all businesses. But we do have to limit indoor crowded spaces. Very important, indoors. We've got to wear a mask. It protects others. It protects you. So I just implore the American people, I know we can all do it together. You can save your grandfather's life, your children, your friends, relatives. Please do that, and I want to get the message out, and I think everyone's consistent, both in our administration, and certainly you're hearing it in the Biden administration. Wear a mask, watch your distance, wash your hands, avoid travel.
Are you connecting, as a transition matter, are you connecting with the incoming administration on the rollout of the vaccine and other critical issues?
Yes, ma'am. I've had several sort of unofficial, informal calls, and then a very extensive 2-hour in-depth technical and policy briefing on testing. It was extremely positive, very interactive. I have another transition team meeting this afternoon. So from my perspective, on the public health side, some of the public health professionals are well known. We're well known to each other. We're colleagues. Saving lives and reducing suffering is not a political issue. So I think it's going really very well, and all of us on the public health side, pledge to do whatever we can to make the Biden administration as successful as possible, as we're working to make this administration as successful as possible.
I know a lot of people are looking at the vaccine as a panacea, but one of the important pieces of advice is to keep wearing masks in public and in places indoors where you're close, because you can still communicate the vaccine even if you are inoculated.
So we don't know right now whether the vaccine will protect you from transmitting even low levels of virus, because some vaccines work. Okay. You don't get sick, you don't get infected, but you might still be able to transmit. We don't know that yet. So yes, we're saying everybody who's been vaccinated, we still want to have the mitigation measures. Once we get 70 or 80% of the American people vaccinated or haven't gotten the disease naturally, now we want it vaccinated, then this will go away. This will be sort of like polio, where there's still going to be cases, but they're going to be very low. But until we get to that level, we're going to have to still continue our mitigation. Now, we hope to be saving a lot of lives of elderly and chronically ill with the first doses of vaccine, but we won't put an end to the pandemic, the outbreaks, until most Americans get vaccinated. And that's probably not until April, May, June timeframe. We're confident by June, any American who wants a vaccine will be able to get a vaccine.
And of course, the bottom line is it's safe and people should take it and not be afraid. I know that you would be saying that. We're out of time, but Admiral Brett Giroir, thank you very much. We are at a real crossroads today.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.